Kia ora koutou and welcome to this online session of StAC Talk. No mai, haere mai. My name is Tom Matthews, welcome. In today's session, we're going to be dealing with lower back pain in adolescents, and we're lucky to have Sharada Stewart, who you'll be familiar with, who's with Balance Physio, dealing with most of our kids and most of the sports across the spectrum. Really lucky to have her in studio to go through this issue. Sharada, over to you.
Thanks, Tom. I've been lucky to be involved with St Andrews for the last 20 years running physiotherapy services here. We see a lot of musculoskeletal injuries, and the conditions that we've seen over that time have changed dramatically. And a concern that I have is the amount of stress fractures and stress injuries that we are seeing, particularly in adolescents with low back pain. Now, when we see a student for a complaint of low back pain, initially it just starts like a normal assessment. We'll make sure that they've got a musculoskeletal condition, and we're trying to eliminate any of the red flags, which may be things such as inflammatory conditions or infections, and make sure that what we're seeing is actually a musculoskeletal problem. Then our assessment goes through trying to establish a bit of a movement pattern. So are there movements which are more aggravating for them? And that may fall loosely into two categories, maybe flexion and maybe extension. The flexion being the forward bending activities and the extension being the backward bending activities. And sometimes these students will have non-specific low back pain, and that may be just that they get a sore back, nothing really specific in terms of movement preference, but just maybe some achy pains. Now, when we're looking at the sports where extension may be a problem or they may be getting aggravating factors from them, these are some of the ones that we may see. If we're talking about stress fractures particularly, and this is an area of concern for us because we have seen an increase in the number of stress fractures in adolescent children. If we look at the volleyballer here, we can see that they are rotating and compressing their spine in this lower left-hand region. So usually what we'll see is a description in the history of a right-handed person getting pain on their left side. And that's quite a big indicator for us that this may be one of the problems. There are some other reasons for extension-based back pain, but this is certainly something that we don't want to let go by. Here are some flexion-based sports, and again, this is not usually where we see the stress-based problems. They can be sustained flex positions or repetitive flex positions, and again, these are some examples of those. If we're looking particularly at the extension-based problems, and I might have someone who's come in complaining of initially tightness in their back, then maybe the pain comes on after they've been playing their sport, and then it will go away. And oftentimes, by the time they come to us, it's more of a constant pain. And really what we want to do is make sure that we're seeing these people early, and you'll see shortly that that makes a really big difference. The interesting thing about adolescents, when we refer them for imaging, and for that I mean an MRI or a CT scan, X-rays are not really that informative with these cases. It differs a lot from what we see in adults. In adults, if we were to X-ray them and they have back pain, we will only see probably 5 to 50% of them that will have something on an image that tells us, or that correlates with the pain that they're describing. In youth athletes, however, it can be up to 73%. So when they do have problems with their back and they're talking about pain in their back, it really needs to be addressed pretty quickly. In this diagram here, there's a depiction of where a stress fracture normally occurs, and just with all growth with adolescents, their bones elongate when they grow. And you can see from this diagram that there's a red line through there, and that is the area which is probably not able to withstand too much stress, and it's an area that shears quite a lot, and often we'll find a stress fracture in that region. So to understand stress fractures and why are they happening in this adolescent population, I think it's important to have a look at what normal bone growth and metabolism is. So if we're looking at healthy bone when it's loaded gets micro cracks in it, and it replenishes and comes back almost stronger. So it gets thicker or more able to withstand larger loads. So this is part of the reason why we're doing some of this conditioning. But what happens in the adolescent is this whole process of the bone breaking down, new bone coming in, and then the bone mineralizing so that it gets hard again and is again healthy and able to withstand load. Although that's happening, it's happening too quickly. So we don't have enough healthy bone that will withstand the load that's placed upon it. And that may not even be an increase in load. It may just purely be the same load that the student or the athlete has been training at. So if we look at bone stress fractures, we can think of them or stress reactions or injuries as a continuum. So down this end, we've got bone changes which are happening at a cellular level, and we can see that on an MRI. So you might find some inflammation around the area, and this is what we're talking about, a silent stress reaction. It's starting, but we don't really see it too much. As the load continues, this may progress to a stress reaction, and that's when we get more of this bone edema, more of this inflammation, and then a disruption in the structural nature of the bone. And if this still progresses further, the stress reaction may become a stress fracture, and this is really what we're trying to avoid. The stress fractures, again, form on a continuum, so they may progress on a continuum where we will get an incomplete stress fracture and then, worst case scenario, the complete stress fracture. So really, any injuries in any musculoskeletal system really are about capacity and load. And so when an injury will occur when the capacity of the body is exceeded by the load that we're placing upon it. So the load is really how we're training, and this has been really well, the coaches have developed really good training programs in terms of how much frequency they should do of training, what intensity should it be at. You'll find that no two sessions are really the same. The technical aspects of their sport has been looked at to minimise injury and to also maximise efficiency and performance. The equipment we have now has all improved, and so why is this all still happening? One reason is the consistency of training. Just with this adolescent population, the school year dictates that sports stop and start a little bit. So if we take the summer season of cricket, for example, there's a big break there in the middle of the season over those summer holidays. And I wonder whether students and athletes are less active over their holidays than they once were. There used to be a lot of backyard cricket or playing outside, that sort of thing, and perhaps they're more sedentary now. So if we take the example of a cricketer who might have a complete break over those 2 or 3 weeks, come back, maybe do a Saturday, Sunday game prior to their season properly starting, and then they ramp up really quickly. So really we should be encouraging them to maintain some load. A bit of recovery definitely is good, but some load so that they're not going back down to zero and then spiking up again. The capacity of the student. There's a lot of extracurricular activities they're doing. They might have part-time jobs. There's societal pressures. There's sleep. There's devices which interfere with sleep. All of this stuff here really has an effect on what the capacity of the individual is at the time. And the last one here is the peak height velocity, and we all know that they go through a bit of a growth spurt, and I just wanted to mention that there's an injury risk around that time. So if we have a look here, basically we're talking about the maximum rate of growth, so when they just shoot up massively, and they generally shoot up massively before they fill out. And this differs a bit between girls and boys. But again, important that we know and consider the risk is higher for around 6 months, but it may even be a year around that time. So what does reduced capacity look like? I think we've all seen this, particularly in our teenagers. We know when they're not firing on all cylinders. We know when something needs to give, they need to reduce something. We need to be a bit more vocal about when that is, and we need to tailor their programs, including everything, for that. We try to qualitatively gather information like the wellness diaries, and lots of teams are doing this. And again, it's what are we doing with that information? So again, it should actually make a change in the load that we're putting on the youth athlete. There is some talk about calculating the peak height velocity, so you sort of know when that is. But I think for most of us, we know when they go through that growth spurt. We see it. We have to buy new uniforms all the time, that kind of thing. So from a musculoskeletal physio point of view, there are some ways that we can probably tailor our programs a little bit during those times. So there's an emphasis on movement technique prior to the athlete shooting up. What we're doing there is creating maps for movement, which can be used later on in their development. During PHV, as I've said, we just really need to reduce the physical workload. We can increase capacity somewhat and make sure some of those things are happening, but we probably need to just reduce their workload, prioritise sports, prioritise training. And after peak height velocity, this is our time when we can really work on their strength. We make really good hypertrophy gains at that time. And there's a good period here where skill acquisition works very well. Advanced plyometrics, that is using your increased strength to then really improve these forces. With my management, I was talking about how it's really important for us to try and find this or identify this problem, the stress problems early. And the big reason is it could just be like any other injury. So 2 weeks of rest, trying to get them back to not being sore or any pain during their normal activities of daily living, and then a progressive increase. And so that might be a period of another 6 weeks, so perhaps 8 weeks, just like any other injury. Whereas if they progress to a stress fracture, we're then looking at the bony healing, and that can be 6 to 12 weeks, and then the progressive load on top of that. So we're talking about maybe 6 months out of sport. And some of the severe ones, which are not really getting that bony healing because of some of those other factors, may even be 9 to 12 months. So finding these problems really early is really a big change to how these people progress and whether they are out of sport for a long time. So really what you need to think about is back pain in adolescence isn't a normal thing. We need to identify that cause early, be aware of these growth spurts, and really advocate for our kids in terms of trying to help them increase their capacity and reduce their load at these times.
Hey, thank you for that, Sharada. So great to have you here. We've just grabbed her actually for a few more minutes on the couch for a few follow-up questions. So Sharada, I'm curious, my mum worked a lot in healthcare, and she was the worst mum. When I had aches and pains, she would say, "You'll be right," and send me off to school. What should a parent do if their child is experiencing back pains? What are the steps?
Well, I think you should see some sort of health professional. So generally, physios are very good in this area. GPs can be, although in the current state of our health system, they're pretty inundated with things. So I think this is something that a physio can manage quite well, and we do see a lot of it. So I think book an initial appointment, as much information as we can gather from the parent and from the student around sleep, recovery, growth, all of those things. We find that we're often phoning parents and asking some of that information. So if we have that beforehand, that's really helpful. And even if you want to go along to that session, there's a lot of information that you can provide there. And then referrals can be done from that basis. For us, we often involve GPs at that point, especially because that hormonal health and the development is so important to bone health as well.
Right, so get as much information as you can, present it to you or to your GP, and now you'll take it from there.
That's right.
Perfect. Well, you mentioned sleep. How much for back pain recovery or injury, what's the ideal amount of sleep someone should be getting?
Yeah, so I find this really fascinating. There's this big talk about 8 hours a day, and we, always have that around. And obviously, it's different for everyone. And the recommendations actually for children and teenagers is more like 9 to 11 hours sleep. And with their scheduling, that's pretty hard to fit that in. I think there's a really important study which shows that less than 8 hours sleep with youth athletes can result in they're 70% more likely to sustain an injury.
So 8 hours is the bare minimum. Under that, 70% increase in injury.
Absolutely.
So our top athletes, we're really pushing sleep.
That's right. We'd advocate that 9 to 11 hours. And I think in terms of training and what these athletes are doing, where possible, we've got to cut out that early morning session, particularly the getting up early and into the ice bath, that sort of thing. Where, that's really not really advocated. They're better to just lie in their beds.
Sharada is saying sleep is more important than early morning training.
Absolutely. Well, maybe that, if the training can be put in some other time, the conditioning is obviously important, but the sleep is better.
Yeah, brilliant. So that was StAC Talk on lower back pain. Look, if there are any issues, please reach out to the team at Balance Physio and Sharada. They'll be more than happy to help out. Well, we'll see you next time. Ka kite anō.